Hi, everyone. It's a pleasure to be here. Mental health, according to the National Institute of Mental Health, affects 1 in 4 adults, 1 in 6 adolescents, and 1 in 8 children in the US. Mental health disorders have a significant impact on education, productivity, and the economy. The projected worldwide economic impact of mental health disorders is expected to surpass that of cancers, war, accidents, and stroke combined in just over a decade. Despite a plethora of various kinds of treatment options that are out there, it is very difficult to choose a first treatment that is successful at over 30%, not to mention the number of side effects one needs to consider to think about these treatments. Finally, after diagnosis, which can vary across practitioners, many of these treatments remain ineffective. Currently, the only way an individual or a caregiver provides feedback is through intermittent assessments. Therefore, there is a strong need and an urgency, given a 10-year horizon, to be able to track mental health better, to be able to monitor individuals, and to provide individuals with mental illnesses their best foot or path forward. Now, I'm talking about mental health. So one may consider, for most part, that this is a dysfunction of the brain. Therefore, we should be looking at MR and other technologies that can peer inside the skull and be able to look at how the brain functions and its structure. And we've done some of that work. But MR is not a scalable technology. It's not portable. You can't put somebody inside a scanner every day of the week. And therefore, we've chosen to kind of think about observing behavior in other ways. And one of the things that we use are voice technologies. And these days, voice technologies are fairly ubiquitous. Think Alexa, Google Home, and perhaps the device that's in your pocket or in your hand right now. Speaking is one of the most complex acts we do. In this snippet of a film from the early 60s, we see the exquisite control that we have in our mouth.
Why did Ken set the soggy net on top of his deck? I have put blood on her 2 clean yellow shoes. Stop.
But speaking is not just about moving the mouth. It's about orchestrating human communication, expressing thought, intent, and emotion to another person. And it is with this we see that speaking engages more than 100 muscles and a very large network of brain regions. And as such, we think speaking is a window into the mind. But this impressive human ability does not stand on its own. Over the years, we've developed several technologies to analyze speech data in various ways. Now, most of you are very familiar with speech-to-text systems or dialogue systems or chatbots. But instead of focusing on what one speaks, we can also start focusing on how one speaks. And in focusing on that aspect, we start discovering elements about the speaker, both in terms of healthcare and mental health. With our colleagues over at Mass Eye and Ear, we've taken speech recordings of people with vocal fold paralysis and are able to predict very accurately, much better than chance, their paralysis state. And such a system could potentially push aside the need for expensive or invasive laryngoscope till the need actually arises, whether for validation or surgical planning. If we move a little bit further up into the brain, with our collaborators at MIT Lincoln Lab, we've developed algorithms that can detect Parkinson's severity. We're able to detect different degrees of severity as well as specific elements of severity. And these algorithms, some of which are protected, allow us to think about ways in which we can extend this to a broad range of neurological disorders. But what we were really surprised about was the fact that we could detect depression with somebody saying as simple a sound as ah. Most of us do that when we visit our doctor, don't we? And we are able to do this fairly well. So this image shows the ability that we can see the predicted scores against the true scores of individuals assessed with depression. And while this algorithm is not very good at detecting depression severity, it does a really good job of separating people into controls and depressed groups. So we said we need to take this a little further. And with a former grad student, we extended this work to analyze different parts of speech, timing patterns of how different components of what you were speaking change. And we were able to show that for people who were depressed, aspects of these timing patterns relate very closely to their depression severity. So now we have two tools. One that's kind of diagnostic as a filter, and another that detects severity more as a graded function. And this did not hold across the controls. So we're fairly confident at this point in time that spoken communication contains a lot of information that's useful to track various aspects of health and mental health. So what are we looking for? So in the next few steps, we're looking at things that could be turned into practical applications very soon. In the short term, we can take some of the technologies we currently have and turn them into filters for clinical trials. You can use this either as screening someone for a trial or testing someone during a trial. But these technologies also need to be made more robust and ideally connected up with longitudinal information. We want to be able to see how these voice technologies predict clinical evaluations or clinical onsets, episodes, and clinical outcomes. And you want to go across neurological disorders. And that's kind of the medium-term plan, to be able to do so understanding what aspects of speech as a window into the mind give us insight into these different mental health disorders. And in the long term, and I might remind you that the long term is not very far away if we take the 2030 guideline from the WHO, is to incorporate other sensors. That voice is not alone. We want to build as rich a portrait as possible of individuals. And this might come from tracking movement, tracking language, tracking their social interaction. We don't want it one versus the other. And we want to turn this into an adaptive learning system. Hopefully, with those things, we would be able to build risk predictors that might act in the same way currently Wonderground does for you when you go on a trip. You check what the weather is going to be and decide whether you want to pack a jacket or swimsuit. We want to be able to do that for mental health and healthcare. Use these sensor-based technologies to be able to predict future outcomes and risks that you can then take actionable intelligence on. Thank you for your attention.